And I'm now pleased to move to the panel discussion on the role of differentiated service delivery in normalizing HIV prevention, treatment, and care. And I invite the panelists to join us on stage, Kevin Mendez and Chanel Brissett. Please join us on the stage. So thanks to you all for joining us, and I will start with Kevin Mendez from the National AIDS Commission in Belize. And Kevin, could you please share what's happening in Belize and with the work that you're doing on the differentiated service delivery in terms of HIV prevention, treatment, and care? Over to you.
Good. So good morning, everybody. So it's a pleasure to speak on behalf of my role as key population representative within the country coordinating mechanism of the National AIDS Commission. So basically, one of the things that we have acknowledged is that there is the capacity within civil society organizations to work alongside the Ministry of Health in increasing accessibility to HIV services. So two of the strong cohorts that we have within the response in Belize is the Civil Society Hub and BFLA. So along with them identifying key focal points within the community that are able to provide linkage to care. So acknowledging that, it makes it easier for people to, one, know about the services that are available within the country and within the system. From there, being able to provide education, because a lot of people, they would like to know how the service is delivered, how comfortable can they be, where can they find a spot that is more safe for them. And I think safety plays a very big role because, for instance, in Belize City, there's a high increase of gang and criminal violence, so that limits, people from navigating from one point to another. The next thing is perceived stigmas in regards to which clinic they might feel more comfortable going to. So my role as a public figure in Belize within the LGBTI space allows me to have that conversation with them to say, hey, these are your options. Let's talk about it. Which one do you feel more comfortable with? And then from there, we create a referral either with the Ministry of Health system or within the Belize Civil Society Hub or BFLA for them to go ahead and provide that service. So services that are available, for one, is that there's a large conversation that's ongoing in Belize as regards to putting HIV as a non-communicable disease. So whenever somebody comes into the Ministry of Health Service or they come to BFLA, then right ahead, if they're coming for, let's say, a glucose test or a blood pressure check, right away, the point of care contact allows them to ask if they have done an HIV test recently, if they would be interested in one, and then from there, it's kind of like normalized for them to be able to access an HIV test. Another integral part of differentiated HIV service includes mental health support, because a lot of people that would come to this system or that would make contact with me, they're going through a point of trauma. And sometimes all they want to do is just share what they're going through. And being able to be part of their healing journey allows them to be empowered, which is very big for them to be able to then go ahead and feel comfortable accessing services. So continuous mental health support is very key in ensuring that they stay within treatment for PrEP, either for antiretroviral therapy, that they're able to, communicate to their partner and do better negotiation in terms of sexual practices and behaviors. So yeah, that can summarize what we're doing in terms of differentiated services.
Thanks. You. Thanks for sharing that. Sounds like you're doing a wonderful job and making an impact. And so now I'm pleased to introduce Chanel Brissett. She is a psychosocial coordinator at Health Connect in Jamaica. And the same question for you, Janelle. I know we spoke before you came on the panel, but could you share with the team here the kind of work you're doing in Jamaica in terms of differentiated service delivery in HIV treatment, care, and support services? Thanks.
Okay, so good morning again, everyone. It's a pleasure to be here. So I am representing on behalf of Health Connect Jamaica, and I'm a psychosocial coordinator. And basically, we are a private NGO with a client-centered differentiated care model. And what that essentially means is that we provide PLHIV with more options for testing, treatment, and care, utilizing our clinicians, our psychologists, our labs, and pharmacies. So we are primarily funded by PEPFAR through USAID, and the activities are in alignment and accordance with the MOHW, which is the Ministry of Health and Wellness, policies and guidelines. And as of FY 2024, which would have just commenced or ended rather at the end of September, we have linked to care about 904 PLHIV, and about 828 of those who are retained in care, which is about a 92% retention rate. So as it pertains to our differentiated service delivery, we incorporate it in multiple ways, right? So looking at linkage to care, we have over 90 clinicians, labs, and pharmacies in all parishes in Jamaica. We have 14 parishes. And we conduct bloodletting services by our care team, our contact investigators, meeting clients where they are. So that's really our mandate. We try to really meet clients where they are in order for them to access care and basically reduce them being out of care. So our turnaround time to get samples to lab, we focus primarily on that as well. And also to make the network sustainable, the National Public Health Lab is used to process samples and create lab report, but clients directly visit private labs, and the samples are transported by us. So pharmacies and labs are already in practice and are contracted and utilized. So we don't reinvent the wheel as to the services that are offered in Jamaica, we just utilize them effectively. Speaking of our client-centered differentiated model, we basically offer private, quick, and affordable service delivery. And what I mean by that, basically, our services are offered at reduced rate, so it's either free or at a reduced fee based on a needs assessment test that is conducted with patients as they're being onboarded. So for reimbursable patients, those are the ones that we cover completely, and all their services are covered by us. So that's their labs, that's their psychologist sessions, and that's their clinic appointments as well. We also utilize telehealth where necessary in the interim where crucial cases are dealt with until they're able to meet with a clinician face-to-face. When we're looking at linkage to care as well, we also look at multi-month drug dispensing, which basically we try to ensure that patients are no longer without prescription before coming to a next appointment. So we try to set appointment dates about a week or two in advance before they're supposed to come back to meet with the clinician. However, we ensure that they still have drugs in their possession, and we do follow-up reminders through our app and our website, reminding them a week before the appointment, 3 days before, and also on the day of the appointment. So these are some of the methods that we've utilized, and we also cannot forget social assistance, because we can provide the best service, but if clients are not psychosocially, physically, mentally able to keep appointments, it doesn't matter how much we do on that front. So we try to meet them where they are as well in that capacity, where we're able to provide bus fares, we're able to provide packages, food packages, stipends where necessary, just so that clients are able, PLHIV are able to keep their appointments that are set. As the psychosocial coordinator, I'm basically responsible for coordinating the mental health services and psychosocial services at Health Connect Jamaica, HCJ. So primarily what that means is that I'm able to do initial assessments with PLHIV who are coming on board. I basically oversee the monitoring of the service delivery impact, so tracking our counseling sessions, our follow-up rates, how effective they have been, seeing if we're aligned with our process indicators and therefore our overall targets that are set. Basically seeing the flow of sessions, how things are doing, how clients are benefiting from the services that we offer. We also look primarily as well at touch-based sessions. So we can't just be providing a service but not doing the follow-ups or seeing where we can improve. So meeting with the care team, meeting with the psychologists, and also speaking where necessary as well with the PLHIV to see how best we can improve our service delivery.
Well, thank you very much to our panelists for this great discussion.